Hey guys, Dr. Austin here from Inver Chiropractic, and today we're going to be diving into disc bulges, what they are, how they most commonly occur, and the symptoms and sensations you can feel from them. So a disc bulge is, there's disc between all of our vertebral bodies, right? So all of our vertebrae in our spine, and the disc bulge is right in the middle. So what that looks like when it kind of bulges is, as you can see here, it kind of comes out and a little bit off of what the normal disc looks like. A disc bulge is pressure buildup that actually causes kind of a small out pouch of the normal disc, and it causes that to go out out to the sides of the vertebral bodies. And that disc bulge can cause a couple of different issues. It can put pressure on the nerve spaces, and it can also just put pressure on the spine depending upon where it's at. They usually occur for a couple different ways. One, it's either from a trauma or an injury, right? Like a bending over, lift, twist, like if you're carrying something heavy. I'm sure you've heard of those before. Those are pretty common. Otherwise, they're repetitive processes too. So let's say you are, working outdoors and you're constantly bending over, coming back up, bending over, coming back up. That repetitive motion can put extra pressure on the disc, causing it to have that small out pouch or to expand out from its normal location. Another piece of the puzzle is most of the time they come out the back side or the back side, the back or to the side, or both, kind of right from that diagonal piece. The reason that is because most of the time we're in this position compared to going backwards and extending, right? So that extra pressure, that constant pressure going forward, puts more pressure on the front of the disc, which causes the stuff to go backwards, the disc to shift backwards. That's why a lot of times the discs come out and put pressure on those nerves. And the sensations that you can have from that are a couple of different things. One, it can be that sharp shooting pain, the stuff where it feels like that lightning going down your leg, that lightning strike down your leg. Otherwise, you can have the burning, kind of numbing sensation. Those occur for a couple different reasons. The sharp shooting, if that disc bulge isn't constantly compressing that nerve, but it can hit it with certain motions and movements, that's when you're going to get that quick electric type sensation down the leg. But if it's more of that burning, numb sensation, that's when there's more consistent, almost constant pressure on that nerve. And all that's doing is it's interfering with the nerve's ability to be able to communicate with the brain, and the brain be able to communicate with the nerve. So that little interference causes that numbing sensation that you can feel. And you can feel it kind of into the glute, maybe even it's in your low back, but you can also get that numbing sensation down your leg as well. So those are kind of the most common pieces in the way that discs can bulge. If you have any questions on anything we talked about in the video, go ahead and leave them in the comment section below. Otherwise, go ahead and click share if you think there's someone who might be able to use this information. Other than that, guys, I hope you enjoy the rest of your day. We'll see you later.